What if a major development in treating obesity happened completely by accident? For decades, treating obesity medically was an uphill battle. Patients were often told to simply eat less and move more, while early medications frequently failed to deliver safe or consistent results. Frustrated by these clinical dead ends, researchers largely moved resources away from weight loss to focus on a different systemic crisis: type 2 diabetes. By pouring billions into stabilizing blood sugar, scientists inadvertently built the biological foundation needed to address the very condition they had left behind. The result of that diabetes research was Ozempic, a medication designed specifically to help patients release insulin. For these patients, the daily expectation was routine. They had to monitor their blood sugar levels to keep their metabolism stable. However, during the standard clinical trials designed to prove the drug's safety, doctors observed a secondary effect that had nothing to do with glucose levels. The diabetic patients in the study were losing significant amounts of weight without making any conscious changes to their assigned diets. This surprising data forced researchers to pivot, looking past the pancreas to investigate how the drug was interacting with the digestive system. To understand why this happened, we have to look at the active ingredient, semaglutide. It works by mimicking a naturally occurring hormone in your body known as GLP-1. Normally, natural GLP-1 signals the pancreas to release insulin, clearing excess sugar from the bloodstream. But GLP-1 also interacts directly with the stomach. The hormone slows stomach emptying, keeping food in the digestive tract longer. By leaving food in the stomach, this mechanical delay naturally reduces appetite. The weight loss was a predictable metabolic response rather than magic. What began as a helpful side effect for diabetics quickly became the primary target for an entirely new line of medical research. Scientists isolated this fullness factor and initiated new clinical trials to study how semaglutide performed when treating chronic obesity specifically. The data revealed a key clinical outcome. To effectively sustain weight loss, patients required a higher dose of the medication than what was used for blood sugar control. This research led to Wegovy, a higher-dose formulation of semaglutide approved in 2021 exclusively for chronic weight management. By separating the dosages and branding, the medical industry established a way to prescribe one molecular discovery for two different global health crises. For decades, the medical establishment often treated excess weight as a behavioral failure or a lack of willpower. Semaglutide reframed that understanding, proving that obesity is a chronic metabolic condition that responds to medical intervention. Today, these medications are administered under strict clinical guidelines and safety protocols. Patients are monitored for steady, medically supervised progress, replacing the cycle of extreme diets and rapid, unregulated fixes. By combining this biological mechanism with clinical oversight, doctors have altered the long-term outlook for global weight management. A medication engineered to prompt insulin release ultimately provided the mechanism needed to control human appetite. It shows that effective treatments can emerge simply because researchers pay attention when an experiment yields an unexpected result. If you like the video, do like and subscribe for such informative videos.